An estimated 18 million Americans have a sleeping disorder called sleep apnea. Here at the West Region Sleep Center, patients are monitored in rooms like this one. In our next segment, we're going to learn about what sleep apnea is and how the people here at West Region Sleep Center can help.
Obstructive sleep apnea is a condition where the individual stops breathing during sleep. What happens is the upper airway actually collapses during sleep. Sometimes in some individuals those muscles relax and breathing is obstructive. The chest wall and abdomen continue to move, but flow at the mouth basically ceases, and that's what an apnea is. Obstructive sleep apnea does cause arousals. What happens to the patient is that the brain chooses to breathe as opposed to sleep. So when that obstruction to breathing occurs, the individual is aroused. What occurs is the individual may not necessarily wake up, but the brain becomes active, and that's a so-called electroencephalogram arousal. And we know that if that occurs frequently, then then the individual doesn't get into the deeper stages of sleep.
Well, I was first diagnosed with sleep apnea last fall. I had a continuing problem of waking up feeling like I had a hangover, undeservedly, and I would be fighting off this hangover every morning and developing headache along with it.
When an individual comes to us, we generally have to take a complete history, do a physical examination to consider some of these other causes. If we don't come up with another cause, or we have a high index of suspicion, then we refer that individual to our sleep center, West Region Sleep Center. At our laboratory, the individual comes in the evening, and the technician applies electrodes to the head, at the nose, at the chest, abdomen, on the finger, to basically monitor sleep. Then we ask the individual to fall asleep, and we study them the whole night, and then the next day we make a determination: did we get enough information, was there enough abnormality, and we make a decision as to whether the individual needs to stay the next day for more study. But generally, in the vast majority of the cases, we get all the information just that first night.
They woke me up the next morning, and I had my hangover, developed my headache, went away, and they called me a few days later after looking at the results of their study and what came out of the head being wired up and the chest being wired up. And they said I was basically waking up, or partially waking up, 52 times an hour. And I said, my God, I don't remember waking up at all.
If we determine that the individual does have obstructive sleep apnea, there are basically three types of therapy. There's mechanical therapy, where we apply pressure at the nose to keep the airway open. It's called continuous positive airway pressure. There's also an oral appliance we refer to as a nocturnal airway appliance that a dentist fits, that advances the jaw and keeps the airway open that way. And then the third type of treatment that's available is surgery.
Well, I agreed to get the machine at home, wear the mask, and see where we go. Oh, I didn't like the mask. I kept waking up, really waking up at night, sputtering, and this mask is pinching here and pinching there, and the straps weren't working, and, you know, It took me 3 to 4 days, really, to get used to it now, and about a week after I started it, I didn't feel the mask on me anymore at all, really.
The goal of therapy for patients with obstructive sleep apnea is basically to improve their sleep and to improve their daytime function. Obstructive sleep apnea is a risk factor for high blood pressure, for heart attack and stroke, and we know that we're decreasing the incidence of those conditions, and we're actually improving the patient's lifestyle, but also prolonging their life.
With this machine, hey, I'm back to it. For me, I feel marvelous. And I credit it to this machine and the Sleep Center people.
To contact West Region Sleep Center, call them at 216-267-5933. Or for more information on sleeping disorders, check out their website at wrsleepcenter.com. These computers break down your sleeping patterns and help the staff determine what treatment is needed to help you sleep better. After you are diagnosed with a sleeping disorder, you might want to try reflexology in addition to your prescribed therapy.